Good evening and good to have you with us on this edition of the Urban Debate. Viewers, tonight we have a conversation that you don't see that often on prime time. Nevertheless, I believe that this is a conversation we must have in our country today, especially in times of a pandemic, but otherwise as well. In our country, there are lakhs of lives that are lost on a daily basis. People dying because we don't have the right organs for them to be transplanted. In our country, many still believe that organ donation is against their culture, against their religion, is not safe, is going to mutilate their body, and the family will have a tough time. There are various thoughts and myths involved. And so most of us don't even think about it as an option. But let me just give you some statistics. 5 lakh people die in India every year because of non-availability of organs. 2 lakh of them die due to liver disease. 50,000 people die every year due to a heart problem. 1.5 lakh people die waiting for a kidney transplant. Only 5,000 people in our country on an annual basis get a kidney transplant. The reason why there are such rackets that go on is because officially our system doesn't have enough donors. It's because officially people don't sign up to pledge their organs. And unfortunately, in the past 5 months, this year itself, the few who were actually doing that, they have also now stepped back. It's been further hit due to the pandemic, which is why we believe it's extremely important that on World Organ Donation Day, which is 13th of August, we have this conversation. Let's find out how you and I can save our lives. Let's find out why you and I should be pledging to donate our organs after our death. Let's find out what are the facts, the concerns, and what are simply myths about this entire system. Let's talk a little bit about organ donation today here on a national news prime time. And I say good evening to Dr. Vasanthi Ramesh, Director for National Organ and Tissue Transplant Organization, or NOTTO as it's known as, Dr. Sanjeev Gupta, Director, Department for Ophthalmology, SCI Hospital in Delhi, Dr. Brajesh Kunwar, Senior Chief Interventional Cardiologist at Fortis Hospital in Navi Mumbai in Maharashtra, Dr. Pranaw Jha, Senior Consultant Nephrologist, also joining us this evening, and Rajesh Sundaram, a Senior Journalist, is with us this evening with an own experience to share to help us convince more people and advocate the benefits of organ donation. But let me actually first up go across to Dr. Vasanthi Ramesh. Dr. Ramesh, let's talk about why it's so important for every single Indian to know and to be a part of this organ donation program.
Good evening, everybody. I thank you very much for inviting me to be a part of this panel discussion. To me, as I was just talking earlier in the day, every day is an organ donation day. Because every breath that we take, we are thinking only about how to save people who are direly in need of transplants because their organs have failed. And this could be failure of the kidneys, livers, heart, lungs, and so on. I do know that many of you talk about World Organ Donation Day, though there is no declaration by any international or national organization or society to the effect. But I'm all for awareness in whatever name anybody does. The most important thing in our country is for more than 1.3 billion population, we have just 0.5 per million population of diseased donors. I think that's quite miserable, and there is a lot that we can do. And what is it that we can do? We can make brain death declaration mandatory, as has been done legally in states like Kerala, and educate doctors about brain death so that the declarations will be done, because only if brain death declarations occur will organ donations occur. So the awareness and increasing education levels have to be multi-pronged. It has to be among doctors, among medical students, among the public, among the graduates, postgraduates, and postdoctorates at the university level. There is no one who should go or be left alone without being imparted with the knowledge about organ donation and how it can transform lives. Why am I saying this? According to the WHO, in 2015, there were about 1.5 lakh road traffic accidents in India. Why are we talking of road traffic accidents when we are talking about organ donation and transplantation? It is because it is the patients with head injuries sustained largely due to road traffic accidents who become the potential donors. And if these potential donors are identified, and if and when they get into the state of brain death, they're so declared, and the Transplantation of Human Organs and Tissues Act has made the required request mandatory to those patients admitted in the ICUs in any hospital in the country to seek for organ donation. The relatives should be apprised of the possibility of organ donation of their near and dear ones who are in a state of brain death, and their consent should be taken.
Right.
They have a right to say yes or no, but it is the duty of the health professionals to seek the consent. So this is as per the law. So when these things become a reality, I think the shortage of organ donations is unlikely to be there in view of the fact that if about 70%, say, of the road traffic accident patients have head injuries, so it would work out about 105,000 people with head injuries. And of that, if 50% were to go, say, into a potential donor stage, we have about 50,000. And if a percentage of that, say, even 50% ultimately become brain dead, that would be about 25, 30,000. If all those donors were to donate, from each donor, we would get about 8 organs. So that would work out to about 2.5 lakh organs donated for the purpose of transplantation. So I'm sure we'll be able to wipe out all waiting lists and we may be in surplus. So therefore, I know that we do have patients who are waiting for transplants. We also have potential donors. So if we can increase the level of education in the community so that every potential brain dead donor who becomes a brain dead donor opts to donate organs, the relatives opt to donate organs, then I think it is a win-win situation.
Yes, okay, I take your point. Thank you for setting this up for us. An interesting statistic that Dr. Ramesh highlighted was the statistics where India stands versus, say, let me give an example of rest of the world. 0.26 per million population in India are donating. 26 per million population in USA do that. 35 per million population in Spain do that. That's the level where other countries stand. And that's the level we need to reach because our requirements are that big as well. Why don't we do that? What's the biggest hesitation? Dr. Brajesh Kunwar, let's begin with you. What's the biggest hesitation that people have How do we convince them that you should sign up now?
Yeah, good evening, Tanvi. See, the main problem with organ transplantation, I am being the cardiologist, I will talk specifically about that as well. See, the most important problem with our country is the medical infrastructure and the logistic approach, the finances being involved, and people believe. See, out of all the organ transplants, the cold ischemia time, that's a time during which the organ has to be transported from the donor to the recipient, the heart has got the lowest one. See, the heart has to be transported from the donor to the recipient within 4 hours. If you don't do that, the mortality or the results are not good. So the medical infrastructure, if you see the country, only few centers are doing heart transplant or other transplants as well. And the logistics, see how many countries, how many parts of our country are connected to a proper airlines. See the traffic and all those issues. You must have heard about the green carpet and all those things being laid down to transport a heart. But how many times it is possible? And third thing is, the most important thing in our hospitals is people are not notifying the brain dead. See, you cannot take a heart of a live person. See, you can donate one of your kidney if you're alive to your relatives, but you cannot donate your heart. The patient has to be brain dead. And that notification is very, very important. See, the ICUs, it should be mandatory that all ICUs, they should have clear-cut notification that if they have somebody died of brain dead and whether the patient is eligible for the organ donation or not. The fourth thing is, there's a common belief, in many people that once you donate your organ, you may not get that organ in the next life. That is also a problem. So that, that beliefs creates a problem. And the country is doing so badly in dismal in organ transplantation. The heart organ transplantation is very, very important because, see, if you see our country's epidemiology of the cardiac conditions, we are getting very young patients. See, most of the cardiac patients are from 20 to 50 years. They get heart attacks at younger age. Their heart becomes weak at younger age. So over a period of time, if you don't sincerely or seriously support this organ transplant, we will have a people around 20 to 50 years who will have weak heart and they will not have anything to do, and that will be a loss of a lot of to the country as well, because they will not be giving back to the nation in terms of productivity. So that is what I feel. These are the main 5 factors which I feel. One is, as I said, infrastructure, logistic, people believe, and our ICUs are not reporting brain deaths.
Okay, actually, the lot of debate really is about brain dead, and one of the fears that often people say and comes to their mind really is to say, well, what if the doctors don't try hard enough to save us? Dr. Pranaw Jha, that the doctors, if they know that our organs can be used elsewhere and multiple lives can be saved, what if they don't try hard enough to save us? That's a fear people often cite.
Yeah, as you rightly pointed out, I mean, as the previous panelists have spoken about this, that the important thing is about the awareness, and awareness lies about everything, starting right from the point that you can donate your kidney after death, and the myths to be busted. But another important thing is about the trust in the healthcare system, because as soon as somebody is told that whether you you want your the deceased one to donate the kidneys to be, or the organs to be donated, the first thing in their mind which comes is that whether it's being declared just because for the donation purpose. So counseling is very important in that, and that's why you need trained person for counseling well these patients, that the prime purpose for a doctor is to save the life of the patient, and every effort is being taken for that. But just because of the nature of the disease, the brain death has happened now, so it is the right time for donation. So counseling is a very important aspect in this.
Yes, of course, consent is one of the biggest things which is there. Let me also bring in Rajesh Sundaram. Rajesh, we need to really, help people understand why it's important. Often it doesn't hit us home until we see it around us, until it happens to one of our relatives who's then desperately waiting for some organ donor to line up, whether it's kidney or heart or liver. Experience-wise, something that you can share with our viewers tonight?
Well, I've gone through the whole process, because I was diagnosed with CKD stage 5, and I was on dialysis for 3 years. And my wife had initially said that she wants to donate her kidney, and I said, "Oh well, let's go through the process and see how it goes on." I thought I could live on dialysis, but then you soon realize, the cadaver transplant system has a lot of flaws in this country. For instance, like Dr. Jha was saying, there has to be trained professionals who are at ICUs and hospitals who counsel family members about uh, donating organs, bust the myths right there. Tell them that if the patient who's on their deathbed does donate organs, there's 8 people or more, if you consider tissues, who can be saved, that they would get all the spiritual benefits of having changed and transformed and given so many lives, rather than the old myths about how they will not get that organ in the next life. I think the states that are successful or have a high rate of people wanting to donate, especially those, the cadaver donations, are those who have a very effective and robust system for counseling at hospitals. And those that do not clearly have a very poor rate. I've gone through this whole process, and my life is now transformed after my kidney transplant surgery happened a year and a half ago. From a stage where I was on dialysis 3 times a week, I'm now traveling. I spend time with my family. I'm back to doing my work. I walk 10, 15 kilometers every day. I exercise. I live my life to the fullest. So I couldn't have done that unless I received, a donation, a kidney donation from my wife, and that's what transformed. And thanks to Dr. Jha, who's on the panel right now, who really went through the whole process with me before the transplant, during the transplant, and indeed after the transplant, to make sure that I'm living a life which is as close to an ordinary life as possible. So yes, all these myths need to be busted. There has to be an institutionalized mechanism, an institutional mechanism where there is counseling that happens at every level. People may have donated their kidneys, but at the end, if the relatives say they don't want the organs to be transplanted, that's where it ends. So clearly, there has to be more awareness. There'll have to be more shows like this, and also at hospitals, NGOs, all of them will have to work together to make sure that somebody committing to give their organs actually translates to them when the time comes, giving those organs, helping out the dozens of people with their tissues and organs.
Actually, yeah, that's a very interesting point. And let me see if I can, take that up and go across to Dr. Sanjeev Gupta. Is there also a problem in terms of the kind of counseling which is available at the hospitals? That people have so many fears and doubts, and there isn't a very clear attempt, at least on a larger scale, to separate the myths from the facts.
Good evening. As the previous speakers have mentioned, you see, we have to educate people that there is no religious or any social stigma attached to it. You see, that's very important. Especially in our case, in I, we have to convince them that there's going to be no disfigurement before the funeral. So once we educate people, so most of these issues can be solved by education and counseling them, the relatives especially.
Okay, yes, that's one aspect. The other aspect, of course, also that Rajesh mentioned that, I wanted to ask was about follow-ups. Dr. Ramesh, when people do show the inclination or at some point do pledge, what is the system which exists to follow up to a point when finally, those organs can be taken?
According to the Transplantation of Human Organs and Tissues Act that we have in vogue, the brain dead patient's relatives have to be asked whether indeed the patient had pledged at any point in time. That would be the first question to them when they express willingness or would consider donations. So if they say that, yes, they have pledged, then the relatives are requested as to whether they would wish to turn his desire into reality. So this is what the Act says. How much it is effected in all the states and union territories of the country is what would really decide as to how the increase in donations can really happen. We are also trying to see whether we would be able to link up the pledging with the transplant centers when we upgrade our website, the Noto website, in such a manner that they can visualize whether a patient, if and when he's also admitted under them, and if he or she is in a brain dead state, whether he or she has been a donor on the Noto website. So we are considering all these things. The issue is that we cannot use Aadhaar freely. If that was possible, this would be very easy. Since that is legally not possible, if they volunteer, it can be done. But otherwise, we will not be able to enforce it. Once there is a biometric identity which can be attached to this pledging, then I think it would not be difficult to go through with it. That they can also view it in the transplant hospital. So if a patient is brain dead, then they can see whether that indeed that patient has pledged, even if he does not carry his card with him, provided the biometric identity is possible.
Okay, I just wanted to also, read to our viewers the huge mismatch which is there in the demand and the supply. For example, if you really see in our country, and this is as per the information that's available on the National Organ and Tissue Plant Organization's portal, each year, viewers, each year, there are about 2.5 lakh people in India that require a kidney, 80,000 people who need a liver, 50,000 need in heart, 1 lakh of them need cornea transplants. In comparison, this is the requirement. This is how many people need a donor, need an organ. In contrast to that, how much are we able to successfully provide? That's where the sharp contrast is. In 2018, hardly 10,000 organ transplants happened in our country. Just 10,000. A large percentage of that obviously being the kidney transplants, not even eyes. One would assume that, that's something, because it's been a campaign, it's been talked about and pushed for so long, people would have managed to do that. How do we change this is the big question. Rajesh, there was a point when I remember Aishwarya Rai was roped in to campaign for eye donation, to sign up and pledge for her eyes, and I think that became a huge talking point. At least people were talking about organ donation, how to go about it. Do you think that steps like those need to be done on a regular basis? Bring in big faces, influential people, big names to talk about organ donation?
Absolutely. I mean, whatever it takes to bring attention on this particular topic. It's World Organ Donation Day, so we have a few shows around it. But if there is a sustained campaign, also there is, in terms of policy changes, like for instance, the Aadhaar linkage, that's a no-brainer. There are certain countries in the world which there is a legal standing where you'll be assumed to be an organ donor unless you specify otherwise. Why can't we have a legislation here where everybody, unless you go to a website and say that I do not want to be a donor, is a donor, let's assume that will ease the situation so much. So what is required is sensitivity among the policymakers to this particular issue, for a focused approach, for more people, more celebrities, more people who can influence opinion to come out and pledge their organs and to indeed donate organs, when the time comes. So all of this will definitely help. But I think a big thing that is missing is a policy push in this direction. There have to be political will to ensure that this mismatch in demand and supply, which is leading to all kinds of illegal activities, which is leading to all kinds of exploitation, should end for good. And I think there could be a legislation which says that anybody is a donor unless you come out there and say you don't want to be a donor, instead of it being the other way around. It's happening in other countries. It's working. There's no reason why it shouldn't happen here.
Yes, actually, I was going to raise that point, and maybe Dr. Brajesh Kunwar, you can come in on this. What is it that the other nations do, to incentivize, to encourage, to convince people to step up and donate? Some of the practices from across the world, perhaps, that India can look at and use.
Yeah, see, I think the most important thing is as he rightly said, we need to campaign this rightly. See, people should be aware of what is the organ transplant, what benefits we have. Like you have a journalist sitting with you, and he talks very clearly that 1.5 years ago he had a kidney transplant and he's doing so well. Now the message, whoever is listening this telecast, is very clear that there is a huge benefit of kidney transplant. Similarly, I mean, there has to be more and more programs, more and more debates, rather than talking only about politics and all sorts of things. We should have more and more debates for transplants so that we can promote it. Second thing, the government policies and government laws has to ease it out. It's not in India, it's not an easy to start, donating kidneys and all those things. See, I see my friends, even though the heart transplant is not happening very frequently, but I see my fellow nephrologists, when they get into a transplant, the whole system, everything else stops. So the system has to ease it out. The people need to. And second thing is that the government has to come out with some strict laws. I mean, see, once your relative has died and he's a good candidate for a transplant, let the government take a call on that, whether donation should be done or not. See, government should be taking call, not the relative. See, why it is important? Because in cardiac transplant, the time is very less. See, the counseling, of course, has an important place to work. But what is important in heart transplant is take a decision if the patient is brain dead, and not only that, we have to arrange a logistic support so that the organ reaches on time. Otherwise, it's all waste. So, when the system or when the laws are very, very clear, when the people know that they have no options, they have to they have to donate their organs, I think the things will ease it out. And as you rightly said, we need to involve celebrities. We need to involve, more and more, like ma'am we have from Noto, more and more, so that people are getting aware of organ transplant, which is such an important thing. See, I've seen patients living 15 years post-transplant, heart transplant, and they are doing so well. So, suppose we already have one person in the panel who had a kidney transplant 1.5 years back. Suppose we have a patient like that who has a heart transplant 13 years back. See, you definitely give a very good message. Why it is important is the cost of transplant for cardiac in Mumbai may be reaching somewhere around 20 lakhs. Somebody is ready to put a 20 lakhs. You need to see the results. People need to know that the transplant result, even in India, is very good, and many centers are doing excellent. So that is what is important. I feel the awareness is very important, and we should have more and more NGOs, more and more support for people who are involved in the transplant, either the recipient or donors. We need to have dedicated hospitals. See, you cannot run this system unless you have a very dedicated hospitals. So you should have a hospital and a team which should be dedicated only on transplant. Then only you can have good results. You cannot have once in a 6 month one transplant done, one in a 3 months one transplant done. The people has to have a daily work. They should have a daily patients. Then only we will reach a point where our results will be good, and we will be able to show people that transplant is safe. It gives a new life. And see, it's so heartening to see Mr. Ramesh sitting in the TV and saying that my kidney was transplanted. I'm doing so well. So similarly, all our organ transplants.
Yes.
See, in terms of heart transplant, then we need to long way to go. I think there has to be something big happening in heart transplant, because right now, even if somebody dies in Mumbai and taking that heart from recipient to donor, from donor to recipient, such a difficult job even inside Mumbai. Forget about transporting it from a
Yes.
tier 2 city or tier 3 city to a metro city. that is so difficult. So there has to be something big happening in the field of heart transplant so that we take this thing to another level.
So what's needed there? Creation of, every time we get instances and examples, how about how a special corridor was created so that it can be swiftly transported from one end to the other. But do we need a faster, stronger infrastructure and services to ensure that heart transplants can be done easily, Dr. Kanwar? What's required there?
110%. See, in heart transplant, if you are late by an hour, it's all over. See, this is the transplant which it's impossible without the team. And the team is not only the two hospitals. The team involves the two administration of the states, the cities. So as I'm telling you, taking his heart from inside Mumbai 4 hours and arranging it everything is not an easy job. So think about bringing it from somewhere, from Bihar, from UP, from Punjab, and then how to do that. See, ideally, all the centers, all the cities, the number of cases should be more. See, suppose if we have a heart transplant center in Lucknow, they can utilize the heart, the brain dead people happening in the Lucknow. Why that need to be transported to Mumbai? So the more and more infrastructure comes, see how many education centers in our country, they have a fellowship in heart transplant. You ask me. See, most of the people who have done heart transplant fellowship, they go abroad and do it. So why don't we have a medical structure where everyone is taught about heart transplant? See, why don't see, heart transplant doesn't require any stents, doesn't require anything to be fit. Why can't we try to reduce the cost of heart transplant so that people can afford it? Why can't we push this thing to the government hospitals? See, the government hospitals, if they start doing it, it will be a big numbers. And not only that, the people, the students, the surgeons or the cardiologists who are working in this government hospital or getting trained in the government hospitals, they will get a hand-on experience on the heart transplants and what all things to be done, what all things not to be done. See, suppose I decide today that let me run a heart transplant program today, and then I try to find out what all things to be needed in that. If I accumulate that much infrastructure, that means thing, I should have a numbers as well. I cannot have my team of 50, 60 people sitting and waiting for one case to come in 3 months. That is the problem. So everything is need to be improved. Our heart transplant has to go. People should get a right mode. I mean, the TV, the journalist, your program should be more on heart transplant. We cannot have one program once in a year. It needs to be a continuous process, isn't it? So that is important. Finances has to be important.
I agree with you on that.
Yes. Laws has to slow down. And most importantly...
Yes, I agree with you on that. Let me take this forward. So we've got, obviously a lot more organized, clear help, counseling and support system at the hospitals. That's where you can speak to the families, to the patients, help them understand what it is and how to go about it, address their concerns. And that has to be an extremely active part. The follow-up of those who pledge earlier in life and then later when the time comes, that has to be something that we need to look at. Creation of the infrastructure for the critical transplants such as the heart transplant is something that we need to look at as a country, maybe at a policy level. Incentivizing, perhaps, maybe that could be an option. Bring in the big faces, have larger campaigns. I don't know why we don't speak about it enough. It could be a very dry conversation to have, Dr. Sanjeev Gupta. Add to that people don't want to be talking about death. Add to that people don't want to talk about, their bodies being cut up and opened up for organs to be removed. How do we make it a larger conversation point with these kind of barriers?
You see, as mentioned previously, we need to educate people, you see, that there's going to be no stigma attached to it. And we have to make more and more people, we have to ensure that more and more people pledge their eyes. And even after death, if suppose somebody has not pledged an eye, a relative can also sign a donation form and the eye can be donated. So basically, we need to just convince them, that it's for a greater and a noble cause, like you're giving a gift of sight to somebody.
Okay, in fact, there is a lot of confusion about this. Dr. Sanjay, if you want to just clarify on this, can the family also take this decision after the death of the patient that yes, we want to donate this patient's organs,
Yes,
or
the
is
family
it the
can also take a
individual's
decision.
choice in that person's lifetime?
No, the family can also take a decision. Suppose the individual has not pledged his eye, and after the death of the individual, the family can also take that decision after contacting the local eye bank and doing the necessary formalities.
Okay, Dr. Pranaw Jha, let me come to you. One of the other problems or things that people often say is the idea of their own body or their loved one's body being cut open after they've passed away is something that they find difficult to accept. Now, how do you deal with this problem if you're speaking to potential donors or their families?
Yeah, so once again, Tanvi, that boils down to the kind of counseling that you do to the patient's attendant. Because, see, you need to tell them that the surgeries that these days which are used to harvest the organs are not like which will cut open all the organ from every place. In fact, there will be single incision and things will be taken out from there, the organs. And after that, it will be stitched, and it doesn't look like from outside that it's a mutilated body or anything. So that convincing needs to be done for the patients, the deceased patients' attendants, so that their near and dear ones who have expired are in a good condition later on to see, and they should not feel sorry. So yeah, so that counseling needs to be done very well by the coordinators.
Okay, I have another question that in fact one of our viewers has just sent in, and any of you if you want to take it up. What if I have pledged my organs? I am an enlisted organ donor, but the death occurs not in the place where I reside or where I registered, in another part of the country. Is there a national system, Dr. Vasanthi Ramesh? Maybe you can come in on this. Is there a national system to look into this? Because I could be in Mumbai, but maybe the death occurs in another, rural part of the country.
See, when an individual registers on the NOTO website, then it is something that is applicable across the country, number one. Number two, a pledge is not a legal document. So, as one of my earlier speakers elaborated, it is not mandatory even that a person should have pledged for the relatives of the person in a brain dead state to give consent for organ donation. If he has already pledged, it is a fulfillment of his desire. If he has not pledged, still the decision is always with the next of kin. So if they give consent, the organ donation and tissue donation can go on wherever the patient is in the country. There is absolutely no issue in that. Also, regarding certain points raised earlier by different people, for example, education, saving time, I think it is of great importance that the police personnel, right from the highest to the lowest constable who is on duty in a police station, should be well educated about organ donation and the legal process in organ donation, because most of the patients are medico legal cases where the police necessarily have to be involved. For their postmortems to be conducted, the Act very clearly says that the postmortem can be done as a part of the retrieval process. The surgeon can record the findings when it is not an organ which is necessary to determine the cause of death. It can be removed and the surgeon's findings can be taken as evidence in the postmortem. And also the forensic person can be called to the operation theatre where the retrieval is taking place so that the postmortem can also be completed. failing which it is to be done at the earliest so that the relatives do not have to wait to receive the body for the last rites. And similarly, the talk about dedicated
Okay.
transplant hospitals in the country, we have one such hospital in Ahmedabad, which is IKDRC, whose volumes are very large, particularly kidney and next liver. So it's a wonderful idea, but as was clearly pointed out, the cost is phenomenal, and to have in the government setup a hospital exclusively for transplants, I think would take a long time to come, because as of today, it is not even included in the Ayushman Bharat program of the flagship program of the government because of the cost. If transplants were to be recognized, the feeling is that most of the money would go into transplants, and deaths due to preventable causes such as infections, etc., may take a backseat, which can claim more lives than what organ failures would do. So, in a country like ours, where we have to do a fine tuning and absolute balance when it comes to economic policies in health.
Right.
So everything has to be looked into, but nevertheless, we are working hard towards it, and we are creating policies to improve awareness everywhere. In fact, the Director General Health Services had written to the chairperson of the CBSE to include in the curriculum, and also for NOTO to have certain programs whereby the teachers and the students can be educated on organ donation. And similarly, he has also written to the
Okay.
chairperson of the UGC requesting the same for the colleges. And we are also communicating with all the medical colleges to ensure that the syllabus which has been brought about in the 2018 in the MCI is implemented in all colleges in letter and spirit, and also that NOTO could have some programs for the medical students so that their awareness levels are raised, so that at least 5 to 10 years from now, the level of awareness will be far, far higher than what it is today.
I think somewhere we used to do that. It seems to have fallen off the radar. I remember when we were in school, we had a lot of these camps being held in our schools about organ donation. A lot of conversation that happened. Mr. Brajesh Sundaram, my last question to you: do you believe that it's slowly fading from the radar of even our governments in terms of a policy right there in front, in focus?
Well, when I was, into my dialysis, 1 year into it, I had lost hope. And, these are the kind of things that would leave you, when I'm on a dialysis bed, looking about the future of my family, my own career, thinking that probably this is the last job I have, and, all of those things. I would have thought that this should be the policy focus, which is not. And there are many people like me who are still in that situation, who'd probably not have a shot at getting an organ. So clearly this has to be the focus. I mean, right from schools to colleges, everywhere, this has to be what needs to be done, because there are people who are desperately in need of these organs to save their lives. So it's about saving lives. So, and there's no reason why policy that can enable this should not be priority. There's no reason why education which enables this is not priority. There's no reason why whatever it takes, in terms of technology or anything that needs to change is not changed. It enables people to save lives. I can tell you that if I didn't get this organ donation, if doctors like Dr. Jha did not do the work they were doing, and indeed each one of the doctors on the panel, there would be so much despair among the patients. I would probably not be alive today if it were not for the donation. My wife donated her a kidney to me, and that's why I'm alive. And there was an environment which was there. But for 3 years, I was enlisted. I was, on a list of cadaver donations. I never moved on that list. I was in Chennai. I did not move on that list one bit. I was in the hospital
Yes,
at number
and I
2.
think it's such a horrifying
I'm from the-
experience. And
Yes,
that
indeed.
endless wait every single day, hoping and waiting to, hear from somebody, which is why I think we need to have a lot more conversations about this on a regular basis. But a big thank you to all of you for joining me here on this special broadcast. Viewers, think about it. 5 lakh lives lost every year in our country for lack of organs. And we manage to do just about 10,000 organ transplants each year. Look at that gap. You and I can do our part. You and I can step up, not only enlist ourselves, pledge our own organs, but explain it to our family members, to our friends, to those around us, to our colleagues. Have this conversation. Speak to people about it. Spread the awareness. Take it beyond yourself. At least have the conversation with those around you who might just listen to you. That's how we will come to a better place. Thank you so much for joining us on this conversation.